Fighting anxiety is a struggle almost everyone experiences. Having anxiety or worry is a natural reaction to stressful situations that occur during life. A lot of individuals might feel anxious before exams, speeches, job interviews, and endless other stressful situations. Having anxiety is normal, but there are individuals who experience anxiety on a much more severe scale. Generalized anxiety disorder is a disorder causing someone excessive worry or fears. In the article, Anxiety Disorder, the unknown author lists and describes symptoms, risk factors, and treatments that accompany generalized anxiety disorder. The common symptoms of generalized anxiety disorder are restlessness. This includes trouble sleeping and trouble staying asleep. Irritability, which is described as sudden anger or if an individual is easy to upset. And one of the most common signs of generalized anxiety disorder is worrying. Everyday situations can cause worry or fear for an individual who suffers from generalized anxiety disorder. There are some common risk factors involved in generalized anxiety disorder. Traits such as shyness or behavioral inhibition are pretty common for GAD sufferers. Behavioral inhibition is described as the hesitation of showing emotion or the fear that one is not behaving accurately in a situation. Stressful or negative life environments are also risk factors for generalized anxiety disorder. And biological history is another risk factor. If an individual has a biological family member who is diagnosed with GAD, it is much more common for them to be diagnosed as well. There are also treatments for generalized anxiety disorder. One of the most common treatments for GAD is therapy. One common type of therapy is psychotherapy. Rana Parekh in What is Psychotherapy describes psychotherapy as a talk therapy. It involves sessions, and these sessions are normally individual, which means that a patient is alone in the room with their therapist. Depending on how severe someone's generalized anxiety disorder is, sessions can occur once a week or once every few months. Another common therapy for treating generalized anxiety disorder is cognitive behavioral therapy. Parekh describes cognitive behavioral therapy as a therapy that helps people change thinking patterns that are harmful to them. Cognitive behavioral therapy also helps people focus on current problems and solutions to those problems that they may have. Another common treatment for generalized anxiety disorder is prescription medication. Two of the most common prescription medications for generalized anxiety disorder are anti-anxiety and antidepressants. Anti-anxiety medication, such as benzodiazepines, help relieve a patient's stress levels. Antidepressants, such as selective serotonin reuptake inhibitors, or SSRI, help balance a patient's chemicals in their brain. GAD can be recognized by certain symptoms and risk factors. It is a disorder that can inhibit someone from doing everyday activities that are normally done without any worry or stress. For those who suffer from generalized anxiety disorder, they can search for therapists in their area and medications to help cope with their disorder. I hope this presentation allowed you to learn more about the effect generalized anxiety disorder can have on people, and what treatments they may be able to seek out to help them live a more comfortable life. Thank you for watching.